Like most doctors, I went into medicine because I wanted to help people. The issue was that the longer I practiced, the more I realized that there were so many barriers to care. And it affected the way that I felt in providing that care. And more importantly, I think it affected what my patients felt on the other end. And so this was really what got us to start thinking about Vertrae as a concept. A few years ago, my wife and I were sipping on a glass of wine in Temecula, California, and I started reflecting on my own career as a brain and spine surgeon. And I started voicing what I wanted the rest of my career to be like, what I wanted to feel, and then it really shifted to what we wanted patients to feel. We had to start to intentionally remove these barriers and to reimagine the care that we delivered. And it became an obsession of ours and really a journey together that we've embarked on to build Vertrae. Everything at Vertrae is about the intentionality. We want patients to see and hear and sense things that generate really an emotive response, a set of feelings in them. We want them to feel like they are cared for. We want them to feel that someone is listening to them, that they're important, that they're not just a number, that they're a unique individual with unique circumstances. Physician-patient relationships are based on trust. I believe that one of the key ways to build that trust is to listen to people. The longer I listen, the more I understand not just their clinical context, their symptoms, etc., but I also get to understand that person and what their goals are for seeking care. I try to treat patients like I would want to be treated. Surgery is something that cannot be undone. I've seen it transform patients' lives. I've seen it save patients' lives. At the same time, surgery has risk, and I try to make sure that surgery is the very last thing that we do, if possible. If surgery becomes necessary, we also want to do the least possible surgery. That's one of our focuses, is on minimally invasive surgery and doing the least possible surgery to fix the problem. We are here to walk with patients along that entire journey. We have a team of nurses that are called spine navigators. What's unique about them is that they specialize in spine care. So because we do only spine surgery in this facility, all of our nurses are experts on this topic. At Vertrae, we talk about being back on track. It speaks to the journey that patients go through as they recover from neck or back surgery. We're very fortunate to have an in-house physical therapy department, and that actually is right next to my office. So I get to see patients come in for therapy day after day and to give, the high fives as they are working hard towards their recovery. Every day I get to see the impact of what we do here at Vertrae, and it's really a team effort. What I do in surgery is just a small part of it, but our therapy team can often really take that to another level. Motion is life, and life is motion. Living things move, and we are very focused on getting patients back on track and getting them back to life.